Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 54 new cases of COVID-19 in Windsor and Essex County. 15 are close contacts of confirmed cases, 8 are community-acquired, 2 are outbreak-related, and 29 cases are still being investigated. We have had 15,245 cases since the beginning of the pandemic. 14,350 cases are now resolved, and 482 people are active at this time. 34% of our active cases have the variant of concern. We have 786 preliminary or confirmed variants of concern identified in Windsor-Essex County, with 90% of our cases having the UK variant. 2 cases have the South African variant. 16 people from Windsor-Essex County are currently in the hospital and 4 people are in ICU. Our community has lost 413 people to COVID. There are currently 15 active outbreaks in Windsor and Essex County, 11 workplaces, 1 long-term care home, 2 schools, and one community outbreak. Now for our vaccine update. 151,954 doses of a COVID vaccine has been administered to Windsor-Essex County residents. 138,370 people have received at least 1 dose. Regarding our mass vaccination sites, we are currently vaccinating people 60 years of age and older across all vaccination sites and those with highest and high-risk medical conditions. In addition, those 50 years of age and older living in one of the identified hotspot postal code areas can be vaccinated. These are neighborhoods where the postal code begins with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. When you attend your appointment, please bring proof of address, whether it be a driver's license or a current bill. Anyone living in these areas requiring transportation, please contact Vets Cab in Windsor or Sun Parlor Taxi in Leamington. Free transportation has been arranged by the Chamber of Commerce. In addition, Transit Windsor is offering free bus service to mass clinics in Windsor. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca, or if you need assistance, please call at 226-773-2200, and someone will be able to help you. For general inquiries regarding vaccination or COVID-19, please call 211. We would also like to remind everyone that individuals 40 years and older may receive their vaccine at one of the participating pharmacies in Windsor-Essex County with AstraZeneca. We'd like to remind you that despite the vaccine rollout, public health guidance is still necessary. Maintain a 2-meter distance from others, wash your hands with soap and water regularly or use an alcohol-based hand sanitizer. Wear a face covering in public spaces outside of your home. Avoid touching your eyes, nose, and mouth with unwashed hands. And stay home if you are sick and get tested if you have any signs or symptoms of COVID-19. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As you notice that we continue to report our case rates anywhere between 40 to 60, 70 on some days, we are still at a risk of spreading COVID in our community and making things worse for our region. We're already seeing the impact of VOCs. Majority of our cases are coming back as VOCs in the region, with the predominant strain continues to be the UK variant. And as we know, UK variant has a higher likelihood of spread than some of the other variants that we have seen. So in a very short period of time, we can see our case counts multiply significantly to a level which could put the entire healthcare system at risk. We have already seen the experiences not only from our past experience in December and January, but also from what is happening right now in GTA and some of the other areas. We are in a much better position to support some of these hospitals and some of those regions by accepting their patients, whether in our hospitals or in the ICU. So we are able to do that, and all because we are in a better situation. But we don't have to ignore the fact that things can change very quickly. So as much as I like to see that the case counts either stays or continues to go down, but now is not the time for us to lose our guard. We just have to stay in that situation for a bit longer and eventually start to see some progress with the case counts going down and our vaccination rates going up. With the emergence of variants in other countries, some of these countries are seeing the devastating effect with the increase in cases in some of these countries going through the roof and up to a level that none of the other countries have seen before. So it is critically important that we do not ignore what could be the worst case scenario that could happen. So Canada is in a much better position with respect to our cases, with respect to our public health measures. So we have to follow all of these to make sure that we continue to keep ourselves safe. We're also noticing, because of some of the previous data, we have now at least 1 year worth of data with COVID and and we have learned a lot about the disease. We have learned a lot about the transmission. We are also reminding some of these risks of reinfection in some of these individuals who may be previously positive. So anyone who was previously positive, they should not assume by default that they will not get reinfected. There are case reports that we are seeing now that we are seeing some reinfection of the cases in our community. So if you were previously positive, still that means that you are at a risk of contracting COVID. If you are eligible to get the vaccine, please get your vaccine as well. Not thinking about the previous infection could help you with and prevent you from contracting any new infection. It is important that as we continue to see these variants emerging, critically important for everyone to get the first vaccine that's available to you based on your age, based on your priority, based on whatever channel that's available for you. We can only get through when we have a significant number of people who are vaccinated. We are seeing that there are some concerns about people with wanting one vaccine versus the other. All these vaccines are equally safe and protective and with respect to preventing you from severe hospitalization, COVID, and any complications related to COVID. We have good examples from even our politicians and leaders who are getting the AstraZeneca vaccine, which some people are concerned about. So we have seen that it just to show the increased confidence in the vaccine, our leaders are getting those vaccines to alleviate some of those risks. So please get your first vaccine that's available to you. It's critically important for all of us to do that. It is also important that we recognize that the vaccination effort is following a risk-based priority matrix that we are trying to cover. And in covering that, we are ensuring people who are at most risk, people who are at most risk of developing severe complications of COVID, and then followed by people who have some of the risk of exposure in those situations. So we are following this very methodologically based on the provincial priorities and looking at our local data. We are seeing some instances where people are showing up at the vaccine clinic, whether they are eligible at this time or not. We have to recognize that the vaccines are approved for use on a certain age group. So for example, Pfizer is only available for people who are 16 years and older, and Moderna is only available for people who are 18 years and older. Same with AstraZeneca, 18 years and older. Right now in Canada, NACI has approved AstraZeneca for 30 years and older at this time. So there are some age limitation there as well. But so anyone who is not in that age category will not be vaccinated. So it's as much as I understand that maybe there are some interest in people getting the vaccine. If they do not meet the age-based criteria, they will not get vaccine. And then the second one is the risk condition. So there are health conditions that is already identified that who are getting the vaccine, making sure that people are sticking strictly to what is in the document. And I understand there are many medical conditions. There are individual differences even within the medical condition. Some may appear healthy versus the other based on the same medical condition, but there is a system in place that these medical conditions are identified by their healthcare providers or even sometimes in the form of self-attestation. So ensuring that people are adhering to these criteria and following those attestation and using the right information and not falsifying those information. That's also critically important in terms of the fairness of these vaccines going to the right people. With the second doses, we have talked about it many times. Second doses vaccine is important that we are available only to a select group. Second dose vaccinations are not open to the rest of the population. So if you are waiting for your second dose, please wait for your time before you get the second dose. And last but not least, I want to make sure that we are vaccinating our community as quickly as possible. You are looking at our vaccine data. We will get to each one of you who is interested in getting the vaccine. We have our goal to vaccinate as many as people as possible, the majority of our population vaccinated before the Canada Day. So please follow all these requirement and protocol as best as possible, and instead of falsifying any of these information and creating a risk at these mass vaccination clinic by showing up without proper requirement or without being part of the eligible vaccinated group. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
I was just looking at the vaccine site. I'm noticing there are appointments available even for tomorrow and Wednesday. Are you noticing a slower uptake in those appointments? Is it time to open them up further, or what are you seeing with just the booking appointments at this point?
So we have had some discussion over the weekend with respect to opening it up for other eligible band, but we also know that we haven't touched in each of these category as much as we like to see. So anytime we are seeing some opening available, we want to make sure that we fill it up with the right people who get the vaccine. And you may see some additional priority added to the current list of priority either as early as tomorrow, but some of these work is currently being done.
And what about further, essential workers? I know you mentioned last week about working with perhaps some grocery stores. Has there been any movement with that? So
we are working on that, and the logistics of some of those workers and identifying these stores would be a challenge. But we are working on our process, and we can share some of those details in the coming days.
Great, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Is there any indication yet from the Ministry of Health that the local vaccine supply will increase?
Yes, so we did hear from the ministry that with the additional doses that are coming into Canada, so we'll, since we have hotspots in our region, so they will be supplementing our supply with additional doses. And that's why one of the reasons that we want to make sure that we want to assure our community that we will have enough vaccine. We have to follow our risk-based criteria to ensure that we are vaccinating the right people. So that's the critical piece. And it's just a matter of a few weeks that we will be in a better position to target all of these people who are at risk. So we will get additional doses, and we will be using them as quickly as possible. We had a good discussion with respect to our capacity and how much we can increase in the coming weeks when we get the additional doses.
Did they give you a date for when that supply will increase? What week of May?
So, yeah, okay.
So we do know that the week of May 3rd and the week of May 10th, we can expect additional vaccine, and quite a bit. So it would be double what we're receiving right now. And the vaccine, some of it is allocated specifically to the hotspot postal code areas. And so we are working on all those plans right now. And as Dr. Ahmed said, we will be, the majority of that will be distributed through our mass vaccination sites at, in Windsor and in the county.
Yeah, it might be early to ask this question, but are you looking at the those people in those hotspot postal codes to continue signing up the same way? It's not going to be pop-up clinics like we're seeing in the GTA, right?
Well, not necessarily. We are talking right now about plans to do a pop-up in the downtown area. So we're just trying to finalize those details, but we are looking at doing one or two. But as we've said before, the fact that one of our immunization sites is right down in the downtown area is really good for Windsor. And we also continue to do mobile clinics, and we have primary care providers that are also distributing the vaccine, and again, the pharmacies. So we'll work with all of those channels to get the vaccine administered when it's ramped up for the weeks of May 3rd and May 10th. And then the allocation will return to a baseline again.
And you mentioned this a few times, so are you seeing people falsifying information about medical conditions to get an appointment?
The way we have it where you sign up right now is that there is an attestation where you have to say that you qualify under one of the medical conditions. It is not verified. I don't know, I can't say for sure we're seeing that, but we do want people to take that seriously and make sure that if they're eligible, that they are using the appropriate means to get the vaccine. And if you're not eligible quite yet, just please be patient and we'll get to you.
And just to be clear, our current supply is around 12 or 13,000 a week. So if you say it'll double, it'll be something like 25 or 26,000 doses.
The allocation is about 22,000 for the weeks of May 3rd and May 10th.
Thank you.
Any questions from AM800?
Just following up on Maureen and Taylor's questions, I'm just wondering about the vaccine, Teresa. Is that Pfizer and Moderna, or is that just Pfizer?
The increased allocation for those 2 weeks is Pfizer.
Okay, thank you. And then for Teresa or Dr. Ahmed, following up on Maureen's question in regards to the mass vaccination clinics, we got an email from a listener saying they went through the website and there was about 100 openings for Monday, Tuesday, and Wednesday, I believe it was. Is there, and I know Dr. Ahmed touched on it slightly, but is there concerns that there's that many openings?
Well, I can start. We don't want to see that many openings. We know we have vaccine. We want to administer it as quickly as possible. We are also coordinating with the provincial guidelines and then what we're seeing locally. So Dr. Ahmed's in all those conversations, and if we can open up to other areas, other priority groups, we will, and get that moving.
And then one final one here, we also got another email over the weekend. For the postal codes, the hot zones, in the Leamington-Kingsville area for their hot zones, is there a delay in people going to the mass vaccination sites to get to get the vaccine, excuse me? One individual said she's been trying to get an appointment for her spouse for 3 weeks and has not been able to. Is there more of a delay or not enough openings in Leamington?
So we have limited openings right now for the general public in Leamington because we continue to vaccinate the farms right now. And so we do have limited availability for the general public, but we'll look at that. And we know that we are moving ahead. We completed about 2,000 doses to farm workers last week and continue to do that this week. However, we did have like a limited amount for the people living in that area, but we'll have to look at that and make sure people have access if they qualify.
Thank you.
Any questions from CTV?
Yes, good morning. Do you have any indication when children with disabilities or medical conditions will be able to get vaccinated?
Well, right now we don't have a vaccine that's approved in Canada for children. So as Dr. Ahmed said, we're just adhering to what is approved in Canada and also by what the eligibility criteria is. So at this time, Dr. Ahmed can speak to any progress with the vaccines, but right now in Canada, we don't have approval for that.
Yeah, no, I think at this time, as Teresa said, that if they are not eligible based on the age, we are not vaccinating them. But for others who qualify under the high-risk medical condition with some developmental issues, they are able to get the vaccine, and their caregivers as well. So if even if there's a young child who is not eligible, one of their caregiver are eligible to receive the vaccine.
Okay, and then I guess with the process of applying online through the health unit system, is there some sort of requirement before they get to the vaccination clinic? Like, will they be turned away? Or I guess we had a concern from someone who went through the stages of applying and then showed up at the clinic, but then were turned away because they didn't meet the requirements. So what is the process, I guess, for people finding out if they're not eligible before showing up?
So I'll start on that. And so first of all is the information that's available. I think with the vaccination that we have, it's been a few months that we have been talking about who's eligible for vaccination. Teresa go through the list every day who's eligible for vaccination. When they're going on the website, there are a complete list of people who are eligible based on what criteria, what condition. All of that information is up there. When someone is trying to book an appointment, obviously they'll have to, the assumption is when you're going through the list, you probably have read all the information and then clicked on the booking the appointment. We can try and put many kind of restrictions on who is getting registered, but it just makes things much more complicated, especially when we are switching from one priority to another. So that's why it is important that we try to provide that education through the media, through our website, through all of these information is to ensure that people have the right information. But after these type of incident, we want to make sure that those are explicitly stated and there is no confusion in people booking the appointment or showing up at the vaccine clinic.
Okay, thank you. And what about the Pfizer vaccine as far as will it be offered at pharmacies as well? Have you heard anything about that aside from the AstraZeneca being offered at pharmacies?
So we do know with the increased allocation that we would like to have discussions with our pharmacies and provide some allocations to pharmacies if they're able to administer the Pfizer. So we have been in discussions previously, and some of them are ready and able to administer that. So that is something we are looking at as well.
Okay, thank you.
Any questions from CBC?
Yeah, hello. It's Jacob here. So I have one question here. Based on graphs presented by Dr. Amos last Friday, it appears that 14 to 17-year-olds are testing, or a group that's testing positive at a rapidly increasing rate. Why does he think this is? Are teenagers just doing whatever they want and ignoring the rules against gathering with other friends? And do the latest numbers reflect the April break?
So I didn't necessarily capture the last point. Are you saying that it's because of the break in the school?
Yeah.
Okay. Well, so first question first. Yes, we are seeing that most of our cases, or half of our cases, are in the 14 to 17 years age range, which typically is the high school student range. And what we are seeing is a function of two factors. So obviously, when we're talking about person positivity, it depends. It is based on how many people are symptomatic, and then they are going to the testing. In most adults, based on various other type of exposure, they may choose to go for testing, and that why your test number increases, and person positivity can fluctuate based on what the true incidents are. In the younger age group, very few people end up in going testing unless they are symptomatic and unless they have a reason to get tested. So that's what drives the person positivity data. And then having said that, you're partly right in terms of the teenagers and in terms of their interaction and how they are adhering to the public health guidelines. Most of them may be just hanging out with their friends, like they're not truly breaking a lot of these restrictions, but just being with their friends. It's also a high-risk activity, and how close you are, and if you're not maintaining physical distancing, you can potentially infect others. And if someone has a bigger friend circle, you can potentially introduce that virus into that circle and can lead to further spread. So that's what we are noticing. Also, on top of that, what we are also seeing is maybe some of these teenagers are involved and engaged in any kind of sporting activity, and which may help to, I shouldn't say help, but which could contribute to the spread of the disease if they're playing very close to each other, and that could be the part. The last point in terms of the having impact as a school break, I don't think so, because a lot of these high school students are already, a lot of them are doing online learning. So I don't necessarily think that the break has anything to do with that, and the person positivity and the increase was seen even before we went into the break. It may have increased a little bit, but it could be just a function of having more cases in our community too. So I don't necessarily see that as a connection with the break.
Just to follow up on that, with the, just the closure of the schools, are you seeing any effect from that?
The closure of the school, we haven't seen any impact on the elementary school mainly. The high school, we are seeing that, yeah, that was the impact, but overall, the way I'm seeing it, these numbers are still relatively stable, and the source of transmission continue to be a family member and then infecting the children. So I haven't seen that even with some of the outbreak or the transmission that we have declared in the school has resulted in something significant. But if our community case rates are high, that puts the child at a higher risk of contracting it. And if these children are ended up in going to school, they could be at a higher risk of spreading inside their school system. So it's all a function of all of that, but we are not seeing any trend at this time other than what I reported on Friday.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, I wanted to ask about the AstraZeneca vaccine. Is our region getting both the Oxford AstraZeneca and the AstraZeneca Covishield vaccine, and is there a difference between them?
So I'll answer the second question. No, there's no difference between them. It's just a different manufacturing country that are producing it. And we are getting, I think, both. I cannot tell you if there's any specific breakdown of or any specific indication of which ones we are getting. I think Canada is getting both, and that's what it's coming down to each of these health units without having any specific breakdown of where it's coming from.
Okay, but you're saying there's no difference between them, so if an individual is concerned about any potential side effects, they would all be the same if they're asking their doctor?
That is correct, yes.
Okay, thank you.
Any additional questions from AM 800?
Teresa, just looking at the outbreaks, the community outbreak, Southwest Detention Center, can you tell us if that's an inmate or a staff member?
I don't specifically know, but I just know we have a case. So as you know, one case can meets the definition, so that's why that is considered an outbreak.
And then sticking with the outbreaks, the retirement home, 3 staff members there. Do we know, sorry, not a retirement home, long-term care home, excuse me. Do we know if those staff members were vaccinated?
I don't have that information with me. Like I don't have that information about the vaccination status of the workers.
Okay, thank you.
So Rob, I can answer your first question about the Southwest Detention Center piece. So we have a staff person as well as an inmate positive. So it's both.
I'm not sure if the rollout is still continuing for the vaccine at the detention center. If it is still ongoing, does this put a stop to it?
Yeah, I know it hasn't stopped. So obviously our team was there and we helped them to vaccinate the inmates, and the staff were eligible to receive the vaccine at our mass vaccination clinic. Our team vaccinated some staff on site that were present, but everyone else obviously are eligible to receive the vaccine at the mass vaccination clinic, and we were working with our hospital partners in the regional hospital to get them all vaccinated. So we haven't stopped that.
Thank you.
Any additional questions from CTV?
Yes, just one more from my colleague, Bob Bellatico. He's doing a story, excuse me, on the patient transfers, and he's just wondering if you would be concerned with more patients now coming from other areas, if it would put a strain on our system if the situation happens to get worse here.
Yeah, I think it really is a lot of ifs in between. So at this time, it's our opportunity to support our other health units. When our situations were bad, we really had to send our people to other health unit jurisdictions, and they supported it. So I think at this point, we'll continue to monitor the situation in our hospital system. I don't have any indication at this time that it's causing any kind of concerns, but things can change, knock on wood. But we are happy to be in that position, not to be concerned about our community, and in fact able to support other regions. So we would like to keep that keep a close eye on if the situation changes, but at this time there's no concern on my part based on what I know from our hospital partners.
And do you know beyond this week how many patients will be coming to the hospital?
I don't, and I think it's just the hospitals obviously are much more deeply involved in some of those discussions, and it's all based on the capacity and based on what is the need from other region, and we are happy to provide that support to other regions in the province.
Okay, thank you.
Any additional questions from CBC?
No, thanks.
Thank you, everyone. Have a great day.